I'm Stacey Ann Providence, and we're bringing you live coverage of the Ministry of Health's update on COVID-19 here in Trinidad and Tobago. Now, this follows news last night that there is a second confirmed case in the country. You can join us on Talk City 91.1 FM as well as on TTT Live online on Facebook.
What time is this? Right, good.
4:15.
Good afternoon, everyone. Welcome to the media this afternoon, to our press conference. I have with me the Honorable Terence Dial Singh, Minister of Health, the Honorable Stuart Young, Minister of National Security, and Dr. Michelle Trotman, Thoracic Medical Director of Cora Hospital. I will now ask Minister Dial Singh to address us.
Thank you very much, Minister Cox. Good afternoon, ladies and gentlemen of the media, and those of you listening live at home. Welcome to our press conference this afternoon. This press conference was called to update the population on what the government has been doing to prepare and to now execute the plans we have been preparing to deal with COVID-19. Let me start with a very, very brief summary about COVID-19, what we know, what we don't know. Let me reiterate that as of today, there is no specific treatment for COVID-19. There is no vaccination for COVID-19, and no one can say for sure when this current pandemic will end. However, the government of Trinidad and Tobago has been dealing with this issue in a very forceful, decisive manner since January 30th, when we implemented our first travel restriction. So the government of Trinidad and Tobago is ready. We have been ready. We have been preparing. The Prime Minister and the Cabinet has been informed, and they have been in control of the situation. You would have noticed that the Prime Minister took the very decisive action yesterday to close schools for 1 week in the first instance until further notice. That is how a leader responds to a crisis, by taking decisive, firm action. What has the health response been so far, and where are we going with the health response? We want to make it abundantly clear that we have set up Cora and Kovat to be our COVID-19 response facilities. Cora will be our secondary response facility, and Kovat our tertiary response facility, because there we have our ICU beds, 22 ICU beds, and over 230 normal beds. In the event that this pandemic gripping the world should rear its head in large numbers in Trinidad and Tobago, the government is prepared to further use the AREMA facility, which will be opening next month. That will give you additional space and additional capacity. We spoke about a week ago amongst ourselves in the RHAs and the ministry to make it easy as possible for persons to get triaged at our accident and emergencies, those with flu-like symptoms. From tomorrow, and it has already begun, each of our major hospitals will have a separate area set up for the triaging of persons with flu-like symptoms. The last one to come on stream will be Port of Spain. That will be done between today and tomorrow. So between today and tomorrow, Port of Spain, Eric Williams, Sangre Grande, and San Fernando will have separate triage systems, separate triage protocols to deal with coronavirus, whether you're a probable case and suspected case, but Dr. Trotman will speak more about that. I want to reiterate that the health and safety of our healthcare workers is uppermost in our minds. And today, I want to thank the healthcare workers for their phenomenal response to this first two-person wave, if you could call it a wave, of positive coronavirus tests. They have been nothing short but of phenomenal. Those at Cora and those at Kovat, where our second case is now in the ICU department at Kovat. So we need the public to partner with us, especially the elderly, and Dr. Trotman will speak much more about that. At this point in time, Minister Stuart Young, at our last post-CAB press briefing, spoke about social responsibility mass gatherings, and he will go into that in much more detail. However, I want to congratulate Father Jason Gordon, with whom both Minister Young and myself have been in conversation with, who took the very brave decision to suspend Catholic masses from today, because those could qualify as mass gatherings, especially with the elderly. So this is where society now is following the government, taking the lead, and I want to really congratulate Father Jason Gordon on that. We want to talk specifically, and I want to talk specifically about other social measures, not going where Minister Young will go. I want to make a recommendation. Supermarkets. Supermarkets are an essential service, if I could call it that. What can we do at the supermarket level where you have to go? Maybe we could ask the supermarkets to consider making disposable gloves available when you go in, and after you leave and you have bought your goods, dispose of them there. That way you stop transmission from touching surfaces. There are so many things that if we all think about it, we can help the government in this response to do. So that is what we are asking people to do. What else is going to be the health response? We took a decision today because prior to this meeting, I met with the CEOs of the RHAs. From tomorrow, visiting hours and the number of sessions of visiting hours are going to be limited, because you don't want persons who are ill visiting your hospitals and seeing other persons who are lying on the bed who may have comorbidities and who may be at risk of contracting coronavirus. So as of tomorrow, there will only be one visiting hour session between 4 and 6. The morning session has now been cut out, and there is only going to be one visitor per patient. However, exceptions can be made at the discretion of the health professionals on shift at the time. You must have some exceptions. But these are some measures we are taking at the hospitals now. So visiting hours are going to be, instead of 2 sessions per day, it is only going to be 1. For pediatric visiting hours, you know, we are very flexible with children. We allow people to stay with them 24 hours a day, whether it's grandparents that come in often, godparents, and so on. We are going to be limiting the access to our pediatric patients, in the first instance, to parents and legal guardians only. You can stay with your children 24 hours a day, but only parents and legal guardians will be allowed into our pediatric units to visit our sick children. In closing off my part here, because we want to hear from Minister Young and Dr. Trotman, the message I want to leave you with this afternoon is that the Prime Minister of this country and the government has been in total control of this situation from day one. It is now for you, members of the public, like the government, to make your own sensible decisions as you go forward. First sensible decision, ignore social media. Social media is causing more damage than coronavirus at this point in time. Listen to authoritative sources of information. And I promise you, Trinidadians and Tobagonians, after 57 years of independence, we have shown the world we are resilient people. Listen to your government, and together, I promise you, if we act responsibility, all of us, we will get through this. Thank you very much.
Thank you very much. We will now have Dr. Michelle Trotman, who will give an overview on the 2 positive coronavirus cases and also protocols in place at the hospital, but not limited to those. Thank you, Michelle Trotman.
Thank you very much. I will first start off with a clinical update on our first 2 COVID patients. I want to emphasize that patient confidentiality is paramount, so I will be giving general information where these clinical updates are concerned. At present, we have 2 COVID positive patients, one housed at Cora Hospital, one housed at Kovat Hospital. The patient at Cora Hospital has been improving, and we expect a recovery within the time frame, which can range with COVID 7, 10, 14, 21 days plus, depending on the clinical scenario. But we do expect a recovery for him. The patient that is at Kovat Hospital is more seriously ill. The good news, and I want to tell you that there is and there are good news with corona. The good news is that compared yesterday to today, that patient, even though critically ill, is improving. I want to give you a quick overview about coronavirus. The word corona comes and stems from the word crown. And that virus has a crown. And the prongs on the crown is what is used to attach to the mucosa. Mucosa is or are linings of your body, around your lips, around your nose, around your eyes. For the virus to get into your body, it has to access through that mucosa lining. So number 1, if the virus cannot get into your body, it cannot become a disease and a disease process. The number 1 way to prevent that, wash your hands, sanitize. There are ways to do that, and you will see as you access a lot of our institutions, the encouragement and the prompts to sanitize and wash your hands. Remember with encounters that we are no longer shaking hands and kissing for these reasons. We are now embracing each other differently. The virus can cause mainly mild disease. Mainly mild disease. Mainly mild disease. I want the message, and I am glad for the opportunity to communicate to the public and to all of you that this is mainly mild disease. In essence, many of us may have corona and never know it. It's a flu-like illness. And many of us, most of us, will respond and never have complications. So then, who might have complications? This is very important. Good news again. Looks like more the elderly. It's not to say that we don't treasure our elderly population, but it looks for now like it's elderly. People with a nice big word that we like to use as physicians that make us important, but I will break it down for you: immunocompromise. A lot of syllables, but easy. Your immune system, which is what we use to fight things, doesn't work as well as others. So those are the people that may not always, but may not do well with coronavirus. Who are they? diabetics, fortunately, especially poorly controlled diabetes. Patients with cancers, patients on medications for cancers that can deplete the immune system, some patients with renal disease. These are the types of patients, and of course patients with HIV and so on, who may have immunocompromised systems, so they don't fight the bacteria well, the virus well. So, in general, a mild disease, more than 80% of us will get better. And those that will not get better are the people who have some reason why they may not get better. So we already know who to look for. It is critical that when a patient comes to us, that we are able to say categorically, who might have this? We call that a suspect case, like a suspect in a crime. We have gone ahead and standardized forms that all our institutions will be using to screen out and figure out who is this person in the crime. It's very, very, very simple questionnaire. And it asks for someone with a fever and. It's a flu-like illness, mild. Most people recover. Those who do not recover will be people with underlying diseases and will have particular symptoms that the questionnaire will draw out. Flu and a symptom from the breathing tract. Another big word, the respiratory tract. What are symptoms from the respiratory tract? Cough, shortness of breath, chest tightness, fever, and that. That mainly sounds like you might have the flu. We all have had it. But what else we may want to add to that to make you think that you might have COVID? Because not every sniffle, not every cough, not every sniffle, not every cough is COVID. It is most likely the flu. So what else are we going to pull out to say that maybe you could have COVID? Well, certainly, if you have been around someone who has tested, and we will talk briefly on testing, positive for COVID. So we know, we've established. Not that you think that they may have been around somebody who's a neighbor, who went down the road, who happened to be there, who you happen to touch with your elbow, because we don't touch with hands anymore. But somebody who has confirmed COVID disease. Something else that we look for is travel in a country where there is COVID. And in countries, there are people who have COVID because they've brought it, and there are people who have COVID because we see that it happens to be there locally. We are looking for more of that, what we call local transmission, and a lot of that we get on the World Health site for the list of those countries. But we're looking for that type of contact to say maybe this is not flu, because remember, most of the people have the flu. I want John public to know that most of the patients have the flu. And most patients, even if you get COVID, will be mild COVID from which you will recover. What else we might look for? Well, this is where we get technical again. There are some people who, they're really very ill. It looks like a virus. We're really not sure. We might think, is this COVID? And we might test them. And our questionnaires will pull that out, and our clinical history will pull that out in terms of figuring out who may have this mild disease from which most people will recover and many of us will never know. Right? I want to spend a little time talking and emphasizing the need for us to take a personal responsibility when it comes to how we conduct ourselves with COVID as it relates to quarantine. So for patients who are returning from countries where there is COVID, we are asking people to do a self-quarantine. Now, I know that there are COVID parties and COVID wines. A party and that kind of stuff is not, even though you're in a place by yourself, that's not considered a quarantine. So stay away from going out into the public for a period of 14 days. We're asking that people impose that self-quarantine, particularly when we have the travel history. And I'm asking also that responsibility, when we ask you to self-quarantine, that you take that responsibility to self-quarantine for the period of time, usually 14 days that we would have asked for. And that means staying away and staying at home. I want to touch a little bit on our clinical pathway. What do we do for you once you access particular systems, health systems, and what you should do if you are within the public or within the private sector in terms of getting addressed for COVID-19, which is the disease that comes from this coronavirus. All patients will probably end up being managed within the public system, for which I'm very comfortable of our capacity at this point. Once you enter the pathway, and we've done your questionnaire, particularly in the public system first to start with, if you qualify for some patients, we will go ahead and say that you are a suspect case. And based on the clinical scenario, we'll then go ahead and decide to do a particular type of swab, where we go behind the nose and behind the throat and check for secretions. And you'll read that there are very many ways of checking, but for now, the way that we are checking is what we call a nasal, behind the nose, behind the throat, nasopharyngeal swab. And while we are determining if we have decided that you are a suspect case, we've done the swab, what do you do next? We will decide, can you go home, and let's use that word, and self-quarantine till we know, or do you stay in a hospital setting and wait for your result? But the patients that will stay in the hospital setting is because you would need to. You need something from the hospital that you don't have at home. Fluids through your veins, another big word, we call those intravenous fluids. Oxygen through your nose, most people don't have that at home. Intravenous antibiotics, again, medications through your veins, which you cannot swallow through your mouth. So if you fit the criteria for those, we might say, come with us and stay in the hospital. Or if you don't have those conditions, but you're immunocompromised and we think, well, maybe we should be looking at you a little bit more closely, we may also say, come into the hospital. But other patients whom we are comfortable with, that they will self-quarantine, we will send them home and wait for their result. So there are a category of patients that we will quarantine even though they don't fit the criteria, because we'll quarantine them in the hospital because we feel that you will not self-quarantine. Because of course we want to contain things. For those patients who are in private or public institutions, once they fit the criteria, they are usually referred to us for swabbing and then to determine whether or not they will be staying in a hospital or out of a hospital. And their pathway might be through their CMOHs in their areas. So some patients, even when they present, can present very, very ill. And those patients may have to be accelerated in their care, in that we take them into the hospital and we have to support them with their breathing. And that's not the normal scenario. That's the exception rather than the rule. The overall message that we want to send here is that this is a flu-like illness. It is mainly a mild disease. Most people will recover. We have questionnaires that will be used to screen people, that to make sure that we extract that information to see who's a suspect case. We are asking people to self-quarantine for those who have traveled, particularly from areas where there is COVID-19, and we are asking that that self-quarantine really be respected. And most importantly, we're asking, as we move along and go around, that we wash our hands. They can't get in, can't cause a problem. Okay?
Thank you very much for that comprehensive information that you have shared with us, Dr. Trotman. I would now like to introduce the Honorable Stuart Young, Minister of National Security, who would speak about our social and personal responsibility, risks associated with travel, and, of course, our reporting and social media responsibility. Minister Young.
Thank you very much, Minister Cox, Minister Dial-Singh, and Dr. Trotman, who I have a newfound respect and loving for. Good afternoon, members of the media, wider viewing and listening public of Trinidad and Tobago. It would be an understatement to say that globally, at this stage, we are in exceptional times. One only needs to look on at what is happening in Europe and right here in the Western Hemisphere with the United States on a blow-by-blow moment, minute by minute, on some of our international news networks to see how this COVID-19 is affecting the globe. Yesterday, the Prime Minister gave a very comprehensive and contextual statement in the Parliament, and I'd ask that people, if you have access to it, go back and look at it, because there were a number of serious messages therein. What I've come here today to say is understand that COVID-19, first and foremostly, is about your personal responsibility and your personal and social responsibility. And there is going to be inconvenience with how we operate whilst this virus is within our midst. We are asking that people do not take actions that will expose other members of the public to unnecessary risk. And it is amazing with what we've been dealing with, some of the instances, examples in the last 24 to 48 hours. Travel. The government came out on Thursday at our post-cabinet press conference, and we urged persons to please restrict travel, and this is travel particularly via air and cruise ships, to absolutely essential travel and emergency travel. I cannot overemphasize that point today. We recognize that at this stage there are a lot of nationals trying to make their way back home, but persons need to understand the exposure and the risk factor associated right now with travel. So please do not travel unless absolutely necessary or it is emergency travel. The government have taken a decision, and I'll reiterate it, that the government funded or related travel is on a stop. There is very little that will qualify for us right now that is essential travel. A lot of the instances and emergency circumstances I've had to be consulting with the Minister of Health and other foreign governments and medical experts over the last 24 hours are associated with air travel, persons in the CARICOM region, international travel. Right now at this stage, and Dr. Trotman and Minister Dial-Singh can correct me if I'm wrong, our cases are imported cases. There does not put a stop to the importation of cases. You saw President Trump a few hours ago when asked a question about the potential of banning domestic travel within the United States. He immediately said yes, it is up for consideration. Shortly after, he indicated that the United States have now gone the full gambit and banned travel from the whole of Europe, including the United Kingdom. We in the government of Trinidad and Tobago are urging persons, please do not travel unless it is absolutely necessary, meaning an emergency. Right now, two of the areas that the CMO had pointed out to me before this press conference in our pre-meeting, two of the areas where this virus is circulating, and I'd add a third, very prevalently, are in international airports and in resorts around the world. Added to that are cruise ships, right? Thankfully, cruise ships have taken, well, vast majority of them, decisions to cancel, but we still have persons contacting us, amazingly, from cruise ships where cases are presenting themselves. In the last 24 hours, I want to make the point, this government will do all that is necessary to protect the people of Trinidad and Tobago. I had 2 judgment calls to make in the last 24 hours as the Minister of National Security after consultation with the experts, where we basically prevented persons from getting on planes abroad to come to Trinidad and Tobago. In one instance, I also gave authorization for the blocking of a particular plane to come to Trinidad and Tobago. These are decisions that we will take as the Minister of National Security after consultation with who I need to. I will take these decisions to protect Trinidad and Tobago. But the message is personal responsibility. Another point I'd like to pick up coming out of what Dr. Trotman says, all persons returning to Trinidad and Tobago, we are asking you to put yourself in self-quarantine for at least 14 days. We are very aware that there are persons returning to Trinidad and Tobago, nationals, citizens, residents, who are returning from countries where COVID is prevalent. And this all ties back into the social responsibility point, avoiding gatherings, avoiding public places, because they have the right to come back. And we're asking these persons to please self-quarantine. So we have persons returning from Germany, persons returning from the United Kingdom, persons returning from other areas of Europe, even some places in the United States. Do not be irresponsible and go and put yourself amongst the public and in public spaces to present a risk to other persons. Self-quarantine, we are pressing for anyone returning to Trinidad and Tobago. Please self-quarantine yourself, as you heard Dr. Trotman say, for up to 14 days. For contact tracing, which we are doing quite a lot of right now, we are going to need certain information. So persons returning to Trinidad and Tobago, we're going to be asking you to provide that information. And then also persons who know that they're in certain circumstances where they're at risk, we are going to ask for the contact information. Persons should refrain from escalating concern. We are seeing, even being reported in some articles, persons speaking and escalating their own personal concerns that are going to have an effect on the rest of the population. As I said at the outset, there is going to be inconvenience to people who take decisions to self-isolate, to self-quarantine. It is going to be inconvenience. There is no need for you to be talking about how the state isn't contacting you. The state can't contact everyone. You would recognize at this stage it is all about prioritization of resources, and there are a lot of people that those resources need to be prioritized to, and our healthcare system is doing a tremendously great job. Social distancing is one of the points I wanted to emphasize. Social distancing meaning keeping that space between yourself and other people when you're out in public places, as you heard Dr. Trotman say, and I don't need to repeat, the touching of persons, the shaking of hands, all of these things have to change right now. Responsible reporting. I have been in constant contact with my colleagues, the Minister of Communication and the Minister of Health, throughout the course of the last 24 hours. It is obvious that there are a lot of people who are going to engage in irresponsible acts, and they're going to be using social media. In fact, I was informed that certain people are using it for political purposes. I think that's also obvious. I didn't need to be informed of it, but that is a fact. There are only 2 sources of official information that will flow for anything to do with COVID-19, the coronavirus, from the government of Trinidad and Tobago: the Ministry of Health and the Ministry of Communications. So use that as your testing. Unless it is from the Ministry of Health or the Ministry of Communications, there is no other official channel of communication of information. And as we've shown, we are going to be completely transparent in this process. There is nothing that we're hiding. So the irresponsible people that authored and crafted a message this morning pretending or holding out to be some medical person, some doctor in a lab, and sending this type of rubbish. Please, members of the public, do not even worry to pass it on. Do not share it. These are not authentic pieces of information. There is nothing that is being done that the government is hiding. So the only official information will come from the Ministry of Health or the Ministry of Communication with the utmost transparency, with, of course, the proviso, as Dr. Trotman said, patient confidentiality. The testing is taking place and there's nothing for us to hide. Schools, a lot of questions at this stage are being asked about schools. This is a very fluid situation, as we said and as the Prime Minister announced. We have stopped schools for the next week, but it continues to be assessed. We will continue to be guided by our medical experts and take into consideration other matters that we believe need to be taken into consideration and make announcements at the necessary instances. From a national security point of view, we have been having meetings. We had another one yesterday where we invited the CMO, and we are prepared at national security to do what needs to be done, including to arrest persons if necessary for the maintenance of public order. We had an incident at the Piarco airport earlier today, and we were prepared to do what needed to be done. And that goes to a point that Minister Dayal Singh made a short while ago. Please, people, when the authorities in Trinidad and Tobago ask you to do certain things, please listen. It is only for your own good. So in closing my part of the messaging, I just want to re-emphasize it is all about social and personal responsibility. Avoid the mass gatherings, avoid the public spaces. When you're in public spaces, social distancing, provide the information, and understand that the government will continue to act in a very responsible and proactive manner. And I end by saying, on the point of responsibility, the sharing of false information and disinformation, the only sources of authority who will speak to COVID-19 and the coronavirus via releases are the Ministry of Health and the Ministry of Communication. Thank you all very much.
Thank you, Mr. Young. Ladies and gentlemen, I would just like to acknowledge the presence of the Permanent Secretary, Mr. Asif Ali, and also the presence of Dr. Roshan Parasram, Chief Medical Officer, Dr. Marlon Rampal, Consultant, Medicine and Infectious Diseases, North Central Regional Health Authority, who would also be here to answer questions. Before I field questions from the media persons present here, we just want to thank the sign language interpreters, Dr. Paulson Skerritt and Ms. Eka McPhee. Ladies and gentlemen, the floor is open. Please identify yourself and the media house first, please.
Drew Brown, TV6 News. Minister Young, could you give any more details on the incident that occurred at the airport you referred to?
What we had at the airport during the course of today is we were contacted that there were persons who were not listening to the authorities. They wanted to board a flight. The airline had taken a decision not to allow them to board the flight, and they basically did not want to listen to the airline and to listen to the authorities and to move on. Understand that if there's a risk of persons, as I said, the airports right now are risky, international airports. So if there are persons who have a risk profile, we don't want them out in public and this type of thing. Self-quarantine, as you heard Dr. Trotman say, if the medical experts think there's a need, they will quarantine you.
The person is quarantined or detained in a holding cell, or what is it?
No. The person was out in public and was not being allowed to board a flight, and then rather than go on self-quarantine, thought that they could just sit there and wait. So the person is now in quarantine.
Question to you, Minister Dayal Singh. The testing, for those who may not know, in terms of how much testing is actually can be done, in terms of the number of, let's say, suspected cases that the ministry may be aware of.
Okay, so testing is done for Trinidad and Tobago's patients by CARFA. CARFA also does testing for other Caribbean territories. CARFA has enough test kits for its current use The Chief Medical Officer has also reached out to PAHO to get even more tests. So right now, there is no risk of Trinidad and Tobago or any other CARICOM territory that depends on CARPHA to run out of tests. More tests are coming on stream all the time. More test kits.
Minister Annalisa Paul, Trinidad Guardian. With respect to that particular question, we've seen a communique from CARPHA saying that they have a maximum, CARPHA member states can test a maximum of up to 20 samples per country. And so in that regard, because they're testing for a number of different countries, how do we know what the true picture is here? It may mean that there may be samples that are still in there waiting to be tested, which could be positive or not.
Valid question. Those were general guidelines put out by CARPHA. I spoke to Dr. Joy St. John myself today, and what CARPHA is doing for any country that has COVID-19 positive patients, those general guidelines are altered. So we now have 2 cases, therefore we'll be having more tests, as Dr. Trotman said, based on the clinical manifestations, whether you're a suspect case or a probable case. And I want to reiterate the point that Dr. Trotman made, because somebody from the media called me in a panic yesterday saying that this office is closing down because somebody has COVID in it. And they called the government department. Absolutely false, and panicked a whole department. A whole department had to shut down because somebody coughed. As Dr. Trotman said, not every cough, not every sneeze is COVID. We are in the flu season. Many people will have either influenza A, influenza B, or the common cold. However, we have clear pathways based on clinical manifestations by a doctor, based on a questionnaire that determines whether you fit the profile for us being suspect of COVID. As Dr. Trotman said, same thing for a suspect in a criminal case, same thing. So we ought not to get carried away, and this is a message I would like the media to carry, that not every cough, not every cold is COVID.
Just before the next question, permitted, I'm being reminded not to leave out Tobago.
Yeah.
So just to let you all know, Tobago has been a very active participant in all of our discussions and our planning and our preparation, not only at the interministerial level of that committee that Minister Dayal Singh and I chair, that there are many other ministries and experts around, but also yesterday at our security meeting, we also had TEMA, Dr. Alan Stewart, participating via video conference. So Tobago is very much a part of it and participating in the preparations and in the response.
Let me just go one step further with Tobago. Dr. Tiffany Hoyt, who is the County Medical Officer of Health for Tobago, is part of the national landscape to treat with COVID, and she reports directly to Dr. Parasram. I have been in contact up to last night with the new Secretary of Health for Tobago, and actually I was recommended to CMO that we actually fly across Tobago on Wednesday to brief the new Secretary of Health. He has discouraged me from flying, even to Tobago, because an airport and an airplane on a cruise ship is not the place you want to be right now. So we have decided we'll be contacting the new Secretary of Health by Zoom or whatever, and we will bring her up to date on the national landscape. But Dr. Tiffany Hoyt in Tobago is the contact person for the National Response Plan for COVID-19.
Good afternoon. Crystal Wilson, TTT Limited. Question for Dr. Trotman. Can you please tell us what is the possibility, if any, of a relapse after recovery?
It looks, and of course, as said before, COVID is evolving. COVID is fluid. Nothing is definite in COVID. But it appears that you may get some immunity by getting COVID. So maybe a mild case of COVID that you don't know about may not be that bad. Yes? Part of the problem with what is happening is because of the numbers and the fact that we are not washing our hands and we are allowing that corona to use its head and get into our mucosa. We're a touchy, feely people. We touch our face, we touch our hands, we touch our friends. So this is a culture change for us. It's going to be a big culture change. I myself every day have to keep reminding myself.
Yeah. Just watch the cameraman there touch his face.
Touch your face. And part of what we're seeing is because there are so the numbers are big because there's infectivity. It's mild, but the numbers are big. And social media is there. And there's excitement. I want to rename pandemic, panic endemic. Because that is what is happening for no reason. I want to re-emphasize it's mild. And it's causing such a big problem because of the numbers and the availability with social media for everybody to know, everybody to comment, everybody to get on it. And if people know me, one of the biggest, what you call that? When somebody say something about you, I'm not a social media person. So as they know, Dr. Trotman is on WhatsApp. Dr. Trotman can't get the Dr. Trotman. We have to take that down a bit and use that social media to help us get the message across. Wash your hands. We will fight corona. We will beat corona. Very, very simple ways, very simple things that we have to do. Wash your hands. And for us as a culture, change our touchy. Have confidence and faith to know that your healthcare system is prepared. I'm very comfortable. I'm very confident that we are ready for COVID with your help. Can't do it without your help. Because the public and the public behavior, that and you are who will change the landscape of COVID, not us in the medical sector and so on. It's the man on the street that will change it. I'm asking the public to change your behavior. Wash your hands. Stop your touching. You see, we are maintaining a distance for a reason.
For a reason.
Start to practice it. Encourage it. Put up your sanitizers and let people know and take down the panic. We don't need it. Use panic when there's a lack of knowledge. You use panic to get people confused. We don't need confusion. We have clarity. We're being guided and we have clarity. So we don't have to panic.
Good afternoon. Jesse Ramley from CNC3 News here, and perhaps Minister Young, you can take this question. We understand that the police commissioner has signaled his intention to do a self-imposed 14-day quarantine. Is the Prime Minister exploring similar measures, given his recent travel arrangements?
The police commissioner has been outside for quite a while, longer than the Prime Minister and all over. So I had a conversation, one of my first conversations this morning was with the police commissioner. I've also been speaking to the Prime Minister during the course of the day. The Prime Minister has said exactly what he needs to say at this stage. He reminded me in Parliament yesterday with respect to that. The Prime Minister has actually decreased almost completely his activity. He came to Parliament yesterday, you would have observed, to make a very important statement to the population and then left straight away. So the Prime Minister is exercising his own social responsibility and caution as is necessary.
Ministers, I'm not sure who would take this question. In terms of social media, we've seen a lot of panic. We've seen a lot of fear-mongering. We've seen a lot of rumors, unsubstantiated in many cases. Can the authorities, or is the authorities here doing anything to arrest this social media irresponsibility? Because the media, as well as you all, are engaged in sifting through a lot of these reports that are coming to us. What can we do? Because, of course, the fear and the panic is still sending people to the groceries, and we're seeing a lot more coming out.
Let's start with that. You use a great term, arrest. I wish we could. There is no panic. All right? So what we've said very clearly is that the only official sources of information related to COVID-19 and coronavirus, and I'm stressing it, are the ministries of health and communication. Those are the only two ministries. So if persons want to be mischievous, persons want to be irresponsible, and persons want to fearmonger, do not take them on. And you, the media, have a responsibility. So we're making it very clear. It can be no clearer than we're seeing here this afternoon. If you are seeing information and it's not coming from health, it's not coming from communication, it is not official government information. And as we've shown time and time again, we've gone through this before. You all would recall when we've dealt with the unusual flooding twice in the last 2 years, it was the same thing. Every single time we will come to the population and say what needs to be said. And it's worth repeating again that there are only two official areas that the government will put out information from: health and communication. Today, I emphasize with the Attorney General and the Minister in the Ministry of the Attorney General and Legal Affairs, Minister Hines, that I would like them to look at the law to see if persons can be prosecuted. As an attorney, I believe persons can be prosecuted for this type of irresponsible behavior, some of which was sent to me today, where certain individuals, including individuals who sit in the parliament, were partaking in what you've just described. So I've asked them to look at that to see what sort of action can be taken against them.
Minister Yalsing, it's a follow-up to something you had said just now. The air bridge and the sea bridge between Trinidad and Tobago, because you had just said you were advised not to travel on at this time on the Untitled air bridge. What do you say to those who have to use the air bridge and the sea bridge?
Okay. So the general advice is that all non-essential travel should be curtailed. If you are going to Tobago for vacation, think twice. If you are going to Tobago for business, where your physical presence is absolutely necessary, and you can't do it over the phone or Zoom or whatever, well, then you have to go. But most of the travel from Trinidad to Tobago are Trinidadians going to Tobago for leisure. That has to be reconsidered now, because the worst places for you to be is in an international airport, on a plane with international passengers. Although it's Trinidad to Tobago, you have tourists who come down here, mix with you. I will even go so far as to say, and to advise all sports administrators to relook at their sports programs. I will even suggest to people, I would not go now on a party boat in the Gulf of Paria. I will not do that now. Because in a party boat, you are packed together. You don't know who is next to you. COVID-19, for the time being, is going to impact on our way of life, as Dr. Michelle Trotman said. We have to adjust how we behave as human beings in Trinidad and Tobago, how we socialize. That is how you beat this virus. We are not going to beat it with drugs. We are not going to beat it with a vaccine, because there is no vaccine. But we can beat it, and we will beat it, if every single Trinidadian and Tobagonian makes the small adjustments in their daily routines. Wash your hands. Don't touch your face. How to cough into the crook of your hand. Avoid places in the public domain that you can avoid. For the elderly especially, because the fatality rate, as Dr. Trotman said, affects the elderly more than the young. And I want to make a special plea to the elderly. To the elderly. We want you around. Eid is coming up. I want you to see Eid. Then Diwali. See you next Diwali. I want you to see your next Easter, your next Christmas. I want you to see your next grandchild. But you can do that if you work with the government. The government has done its part. Now we need a partnership between society and government for the man in the street to do his part. Avoid the crowds, avoid the social touching, wash your hands, and that's what we can do.
I've asked Dr. Trotman, members of the public are asking for an explanation on what does self-quarantine mean. So if Dr. Trotman can just explain to us exactly what you all mean when you say self-quarantine.
Certainly, and I accept the question. I do want to also introduce my colleague, Dr. Marlon Rampol. He is an infectious disease specialist. I'll ask him to expand also. I want to just also take a minute to explain that when we as a clinical team look at patients who may have been suspected or diagnosed with COVID-19, it is a multidisciplinary team. Just as the team that you see before you is a multidisciplinary team. And mandatory on that team is a respiratory breathing expert and also an infectious disease expert. So I will let Dr. Rampol explain about quarantine and self-quarantine. Yes.
In terms of self-quarantine, it simply would mean asking people to isolate themselves at home for the period of time, which is 14 days. The 14-day period is a period within which, if you are going to manifest symptoms, they would manifest. So once symptoms don't manifest within this period of time, which we call the incubation period, then you know that you have not contracted the disease and you will no longer be infectious to other people.
I have a question from social media here. Maybe you can answer it. People need to know what to do after the self-quarantine. Please state steps after self-isolation. If symptoms are developed, then what?
After the 14-day period of time, you are no longer considered infectious. Because if you were exposed to the disease and did not develop symptoms within that period of time, then you do not have coronavirus. Because within that period of time, you would have been quarantined, not exposed to anyone else. So any symptoms occurring after that would not have been related to the initial exposure event that would have triggered that self-quarantine.
I would love to pause. I think you've made such a critical point that I would like you to repeat the fact that, and that's the whole point of quarantine, is that if we keep you away and you isolate when you are symptomatic, it means that once released, we can feel fairly comfortable that this is probably not related to COVID, because you might get the flu after that. Remember, we're not saying no, but it's probably not COVID. So it means after that period, you can free yourself, go ahead, out from isolation, but respect what is going on in society still. Because even though you may be free of that COVID, if you do have it, then you still want to be exercising safe practices when you're moving around. Okay?
I have a question from social media to Dr. Trotman. Persons are asking if it is so mild, because you emphasize that it is a mild, why is it causing significant issues worldwide?
Again, because of the numbers, and I hinted at that before. It's because it's affecting so many people, just the numbers of it, it's coming to attention. It's still mild, but it's just there's a lot of it. And there's a lot of ways that we are making it public, so that is what is amplifying it. That's the problem. The other thing is that even though it's mild, it is putting a drain on a strain on resources, critical resources, which every country really has to look at because of the sheer numbers. So if you normally would dispense 10 Panadol, but because of this, it's 1,000 Panadol, it puts a strain from that point of view. Yes, but it is a mild disease.
Hi, Minister Dialsing. Anna Ramdas from the Express. Minister, I know you stressed a few minutes ago about not, rethinking travel plans. Easter vacation is coming up in a few weeks. Do you think that people should start cancelling their flights from now?
I think that is a very good idea. I think we should visit the Pitch Lake. We should visit Nolly's Tunnel. Go down the islands if you can't. No. Seriously. No, don't go down the islands. Seriously. We need to reconsider our lifestyle for the foreseeable future. Yes. Let me put it that way. We need to reconsider our lifestyle for the foreseeable future until scientists understand what is COVID, until we have a proper treatment, until we have a vaccine. Because what is going to cripple us if we don't pay attention to it, and I want to reiterate what Dr. Trotman is saying, is the sheer volume. It is numbers. You don't want 500,000 people in Trinidad coming down with COVID, as mild as it is.
Yeah.
Because as mild as it is, it will put a drain on both the public and private sectors, the hospital systems. That is the issue. So yes, reconsider Easter. Reconsider going on a plane. Do not go on a cruise. Right? So just reconsider your lifestyle.
I am going further than that. The government's position is a very clear position, and it seems as that's not being understood. Vacation is not essential or emergency travel. All right? So the answer is cancel at this stage. It's not reconsider. It is cancel. And furthermore, I want to make another point, because parents were asking about it. The fact that we've said that there's no school, etc., does not mean go and have non-essential mass gatherings down in certain places and bring a set of children together and everyone liming in certain areas. Until this thing is figured out, and it is not a phenomena in Trinidad and Tobago alone. Just look at your TVs and what is going on international news. And that is the whole purpose, or one of the purposes of this conference here today. Social responsibility, personal and individual responsibility. And that is what is going to guide us through this until the period is over.
Let me just amplify the point that Minister Young is making. No one knows what country will be put next on a travel restriction. You may leave Trinidad, go to another country for a vacation, and then you are stuck there. Let me give you an example. There were 2 flights leaving the United Kingdom today on an airline called Jet2, leaving from the UK to go to Spain, vacationers. You saw the airlines packed. Mid-flight, they had to turn back because they were not going to be allowed to land in Spain. Now, that is non-essential travel, and you disrupt yourself. Put off, reschedule, cancel any vacation plans. Your health is much more important at this time until we understand more what we are dealing with, until there's a vaccine, until there's a cure. Readjust your expectations at this point in time.
Is the government prepared to give financial support to Caribbean Airlines and to the COVID
Mr. Wilson, there's a lot of discipline taking place in the room and persons asking to ask questions with the mic.
We are dealing with the health consequences, Mr. Wilson.
And, all right, so...
Minister Young, seeing that President Trump has now banned travel from the UK and all of Europe, would Trinidad and Tobago follow suit and do the same?
So right now, as we've always said, this thing is very fluid. The government continues to assess. We will continue to take the advice that we need to take from our medical experts, and the government is not ruling anything out at this stage.
Minister Dayal Singh, you spoke about triage areas at health centers and the RHAs. Does it not seem reactionary as opposed to precautionary? Why wasn't this done before?
It was always there for H1N1. We are just reactivating it.
And
it has always been there during the flu season.
And Dr. Trotman, what is your area of specialty, and what is the extent of your management of COVID patients?
I'm an internist. That's
Sorry. Sorry. Are you finished?
No, I'm an internist. That's a specialist that takes care of adult-related medical problems. I'm a pulmonologist, which is a specialist within the lungs. And I am an intensivist, which is someone who takes care of patients in the ICU. So I carry those specialties.
A principal just message, have there been any thoughts with respect to shifting SEA? Since seeing that it is days away?
No, it is not days away. SEA is not days away. SEA is still a couple weeks away. And as I said, this thing is very fluid, and the government continues to assess what needs to be assessed. I have had a number of conversations with the Minister of Education, including 2 today, and I've asked him to meet along with his experts and all of the technocrats at the Ministry of Education, and they will then report to Minister Dayal Singh and myself for us to assess and to take certain decisions. There is no need to panic at this stage. You are seeing what is going on all across the world, including with universities. In fact, I was informed yesterday the College Board in the United States delayed and postponed SAT exams that were supposed to take place today. I don't know how many of you all know that. We will act in a responsible manner, and it is very much on our front burner, the understanding of exams like SEA, CAPE, CXC, and these other exams.
There's a question from social media to Dr. Trotman. Would the flu vaccine reduce the risk of getting COVID or reduce symptoms?
We have no evidence of that. Minister Dayal Singh has said repeatedly, we have no vaccine, we have no medications on the forefront for COVID at this time.
Okay, thank you.
Chancellor Vim with the Newsday. Minister Young, can anyone be forcefully quarantined if they choose not to self-quarantine?
Yes, the Chief Medical Officer, who is the quarantine authority under the Quarantine Act, he has the authority, will answer that question.
So yeah, the Quarantine Act of Trinidad and Tobago actually allows someone to be forcefully quarantined. The CMO is the Quarantine Authority for Trinidad and Tobago. It includes the use of the police force or any other member of the defense force to do so, in addition to which there can be a fine of up to $6,000 or 6 months imprisonment if you breach a quarantine.
It was discussed yesterday, and they have the full support of the TTPS and the TTDF to enforce it.
I was informed that that was strictly for tuberculosis, though.
So on the 31st of January this year, COVID-19 was added to the quarantine schedule of Trinidad and Tobago. Our order was done by the President of the Republic to add it onto the schedule, so anything that is on the schedule is amenable to the Quarantine Act. So COVID-19 is on the quarantine schedule.
Any one of the ministers there, Minister Dayal Singh, you agreed with Dr. Trotman in saying that the COVID-19 is very mild. Given that it's mild, is the decision to stop schools for the entire week a bit excessive?
We took that decision to stop the spread. As Dr. Trotman was as pains to say, and I, what we are dealing with is a cascade of volume. If we don't take decisive action, hundreds of thousands of people will flood your healthcare system. That is why we have taken, and the world, not only Trinidad and Tobago, the world has taken decisive action because of the sheer volume. Okay?
Minister Young, you've indicated you're advising persons now to cancel their vacations. Has any discussion taken place at the cabinet level with how this is going to have an impact on businesses, on the local economy, how persons are going to fare, and like Anthony asked, what sort of measures are being put in place to mitigate for some of these persons, these institutions that are going to feel the effects of what's happening?
Listen, at the end of the day, the government is asking people to exercise social responsibility. Right? At the end of the day, I'm certain there's not a person that would like to contract COVID-19 and suffer the worst possible effects of it, which ultimately can have death involved. So at the end of the day, that is what we're telling people. You need to act responsibly. Obviously, the government is looking at it. The Prime Minister said in his statement yesterday, the Ministry of Finance is doing an assessment. They're looking at the potential effects of this. But we are in very uncertain, uncharted waters. When you look at the United States and you see what they are doing and all other economies, you've seen, for example, Japan. Weeks ago, the governor of the central bank in Japan taking a decision to reduce interest rates. No one knows how this thing is going to unfold. Countries will react in different ways. The United States ultimately can print money, and they can take certain decisions that other countries in the world can't. Right now, as we're here, there's another sub-cabinet meeting taking place. that we're waiting for them to come to us with suggestions on policy on HR issues. So we are looking at all of these things. I have had a number of conversations over the past few days with the Prime Minister and the Minister of Finance with respect to the economy, etc. So there are a lot of things. You would have heard the Prime Minister in his speech yesterday. This is not only about COVID. You've seen the oil and gas economy in the world go down drastically. This week, at the beginning of this week, we woke up to 30% reduction in a barrel of oil internationally. Things like LNG and methanol, which our economy and revenue depend on. There is no longer the demand for it in Asia at this time, so prices are very soft. So people, let us not speculate. We are not into the realm of speculation. The government is continuing to act responsibly and work along with its experts, and we are exploring all avenues and looking at everything. And at the appropriate time, we will make the necessary decisions.
Minister Diaz, I'm not sure if you would be able to answer this. I know that, we've acted quickly to get certain facilities ready in the event that we do have mass numbers we have to attend to. Can you indicate if there's been any sort of, can you attach a figure to how much has been spent so far to get our systems ready, to put things in place, emergency health services?
Sure.
And second, well, the last part, now that we have both of you ministers here and you all are the official communications, basically we're asking, is it that we're going to be seeing you all have a press conference every day to update what's going on every couple of days? Because I know that people were concerned before that there was no information forthcoming following the announcement of the first COVID-19. A lot of people, in terms of, hearing what's happening,
there was
after
no
action.
information forthcoming?
The after action, Minister.
I question that. I have been on every single TV station. I have been on radio. I have had press conferences. I have made 2 statements in the Parliament. There have been 2 joint select live broadcasts, so I reject that entirely. But let me answer your question.
I just want to add that statement has been coming from the Ministry of Health twice a day.
Twice a day. So anyhow, to answer your question about budget, we are now calculating the cost of what we have spent so far, and we are doing a line-by-line examination of what we need moving into the future. I am going back to Cabinet next week with that budget, and we will see what the budget looks like then. But I don't have a dollar figure now. We just did what we had to do. What we had to do, we did it. So that is as far as we reach with the budget. It will be calculated, and Cabinet will be informed of that next week, Thursday.
Could we have a final question, please?
Mr. Dialsing, good afternoon.
Yes, sir.
You spoke about the availability of testing kits at CARFA earlier. You did not put a number of testing kits within CARFA's availability in your previous answer. Would you care to...
Okay. So CARFA, we have to understand what CARFA is. CARFA is not under the control and management of the government of the Republic of Trinidad and Tobago. CARFA came into existence in 2012 under a CARICOM Heads of Government Agreement. It's a CARICOM institution. CARFA has external funding from external agencies, plus funding by member states. CARFA is not a Trinidad agency. Just this campus is located in Trinidad. There's another campus in Jamaica and one in St. Lucia. So I have no direct control over the number of tests CARFA gets from PAHO. PAHO supplies the test kits to CARFA. And as I said earlier, the Chief Medical Officer is working with PAHO to bring in more tests for CARFA.
Is it that you do not know the number of test kits they have?
I just said that, I think. Yes. That is a matter for CARFA. I don't run CARFA. CARFA was set up as a CARICOM agency under a 2012 Heads of Government agency. I have no direct control over CARFA, its resources, its personnel. It's a CARICOM agency that reports to CARICOM. So I wouldn't know the intimate details of how CARFA runs.
Thank you, ladies and gentlemen. Some of the professionals will be here right after, and you can approach them. I want to say thank you for this very lively, informative press conference, and I look forward to all of us exercising personal and social responsibility on the way forward. Thank you.
And that was the Ministry of Health there giving us an update on Trinidad and Tobago's status as it pertains to COVID-19. Well, we saw a number of ministry officials giving us some information, a lot of information. The Minister of Health, Minister of Health, Terence Dialsing there, telling us that Cora Hospital and the Kovat Hospital are the COVID-19 response facilities, and he made sure to let us know that from tomorrow the major hospitals have separate areas set up for triage when it comes to the coronavirus. Now, he also indicated that visiting hours will be limited at hospitals. It is now going to only be that one session in the afternoon, the 4 to 6 session. The morning session has come out. We also heard from Dr. Michelle Trotman, who stressed that the coronavirus is mainly the COVID-19 is mainly a mild disease, and that, well, the general consensus was that the public is not to panic and that they should exercise personal and social responsibility. Now, remember, we'll have more on these matters coming out of today's briefing in our major newscast. I'm Stacey Ann Providence. Do have a good afternoon.
The winning numbers in the National Lottery online